This is The Party with Serene
and Pearl.
Get it right, Poddy.
Hey, so today, Serene and I are thrilled. I know you guys listening are going to be thrilled because we have the encore presentation of Dr. Amie Hornaman. And number one, the show that we had Dr. Amie on for the first time, it was so well received. We have gotten so many questions about it. They wanted to follow up with you, Dr. Amie. They had so many questions for you, like hundreds of questions.
We were swamped.
So welcome.
Yes.
Well,
I want to
thank
read.
you.
Yes, I want to read Dr. Amie's bio because she's amazing, and I want you to all know how amazing she is. Dr. Amie Hornaman is the renowned host of the podcast, The Thyroid Fixer, which I love. I'm a binge listener. And she is known as the Thyroid Fixer. Amie is a doctor of clinical nutrition as well as a leading functional medicine expert in thyroid conditions, hormonal dysfunction, and weight issues. You can go to dramihornaman.com to learn more about her, and she's based out of Erie, Pennsylvania. I always think California. I don't know, because you're so like groovy and you have it kind of like aesthetically. It's kind of, but anyway, Pennsylvania.
Who says Pennsylvania can't be cool, right?
Right.
That's right. That's right.
Hey, Dr. Amie, all things thyroid, again, part 2 for our listeners. Thyroid is such a massive, massive issue with women, and our audience is women. So they are just drinking up this information because there's a drought, right? Out there in our culture, in online, when you go to a doctor's office, it's a drought of information. And you are bringing the water. We are drinking it up. And so you said you'd be so kind as to answer so many questions. So we're just going to throw them at you.
I love it.
Okay, let's go. So the first one came from Michelle. And she said, could Dr. Amie talk about all the things that thyroid affects? I mean, we know it affects hair, nails, skin. We hear about that. But what about internal things like heart, joints, brain, things like that?
Absolutely. So when we think thyroid, we have to think about it as the master gland. It's controlling everything. And that sounds so cliche, like, oh yeah, blame it on the thyroid. But you kind of can, right? So if you are not going to the bathroom every day, you're super constipated, that's not a good thing. That can be thyroid. Now, I'm not saying it is, but I'm saying it can be. And when you go through the symptoms that are connected to hypothyroidism or low and slow thyroid function, and you check off, let's say, more than 3 to 4 of these, then we can pretty much assume your thyroid is a little bit whacked and it's time to get it tested and address something. So yes, heart rate goes low and slow. So we think thyroid, hypo, low and slow. Think of the entire body slowing down. So brain function slows, your memory kind of just starts to go. I'll get patients that say, do I have early Alzheimer's or something?
Yeah.
What's going on? I can't remember anything. Heart rate, yes. Blood pressure goes down. Your body temperature goes down. That's why many thyroid patients are intolerant to the cold. They're cold when everyone else is comfortable and normal. Your muscle tone kind of decreases. Your strength, your motivation, your ability to build muscle slows down. Gut motility, that's where the constipation comes in. So you can really see it connected to, every part of our bodies. And yes, frozen shoulder is one of those really kind of strange symptoms that not everyone has, but it absolutely can be connected to the thyroid, AFib, tachycardia, SVT, 100%. Yep.
Can I ask you something though? I mean, obviously, you get a lot of women, as we discussed last time, in peri and postmenopausal woman ages coming to you. Postmenopausal kind of is sometimes when you can get high blood pressure, more so than at other times. Can you have high blood pressure though and a low thyroid function at the same time?
Yes, absolutely. I'm glad you asked that because you can also have elevated glucose and insulin as well, elevated triglycerides, higher cholesterol levels. So some things go high and they just get out of whack.
Right.
So the insulin signaling is off. Your blood sugar regulation is off. You might be eating exactly how you ladies tell people to eat, and they go get their labs done and they're still pre-diabetic, diabetic.
Yeah.
Look at the thyroid, because you could be doing all the things right. And if that thyroid is off, some parts of your body are going to be off and your numbers are going to be off on your labs.
So interesting. Another question here from Leanna Shoulder. How much does low body temp factor into the hypothyroid world? I did the Wilson temperature protocol, doc agreed to try, which is T3 only, ramping up daily to a max level, then slowly slowing down, I think is what she said. Brought my body temp up from 97.3 to 98.6, but it didn't hold. Did 3 rounds. I felt so much warmer. I am always cold. And thought maybe that could rev my metabolism. Haven't gone back on it. Cost prohibitive, but per Dr. Wilson, should be able to reset body temperature permanently. But temp is back down to 97.3. Is that probably my set point, I think, is what
and
she's
I'd love
asking.
to know about, we hear about online about the Wilson protocol and all that. What are your thoughts on this, trying to do something to reset something and then not staying on something?
I don't like it. So, and I don't even use body temp as a predictor or a prognosticator. It's
Interesting.
more,
Thank you. Wow.
Simplifies things.
I'm on T3 only, and I am on a very high dose of T3, have been for 20 some years. My body temp is still 97.1 usually. Am I going to increase my T3? No, because it comes back to, how do you feel? Yes. How do you feel? And that's what you have to ask yourself. And that's what your doctor should be asking you as well. Because if you say, okay, I'm on X amount of T3 and I feel fantastic, who cares about your body temperature?
Yeah.
Who cares? As long as you are symptom free and you're feeling A1M1, let's keep going.
You know what I love? I love getting out of the weeds.
Yeah, it's like looking under the hood and getting all complicated.
Yeah, but there's a path through the weeds, and that path really can be quite simple, long as you do it wisely, right? And I think that path, when you say, if you're feeling good, that's the path through the weeds. Oh, it's so good. We got to get through these. Nyla says, hey, I've been on thyroid medication, levothyroxine, T4 for many years. The doctor said I'd be on the medication for the rest of my life. Is that true? Or is there an alternative that is better for my overall health? We got lots of these. I think some didn't watch our first podcast. We got a lot of new people in the room. Let's talk about T4. Let's talk about length of life-taking medication.
Yeah, so there's kind of a couple of answers in this one question. First of all, T4 only does not work. It does not work. Right. The stat that I think we gave on the last show was 2% of the population do well on T4 only. 98% need a blend of T4 and T3, whatever that looks like. It could be Armour thyroid, MP thyroid, or it could be your Synthroid and a little bit of T3, liothyronine, cytomel. So whatever blend is going to work for you. So number one, you're probably looking for a way out because you're basically on T4 only and you're not doing well. You're not symptom free. You're not feeling better. And I get many patients like that say, can I just stop my medication because I'm not feeling better anyways? Well, It's not that we want you to stop the medication or the medication isn't working. It kind of isn't, but it would work really well if it was optimized for you and if we added in some T3 and figured out what exactly you need. Number one, then you would be symptom free. And then most likely you would not be asking me if you have to stay on it the rest of your life. You would be like, over my dead body, are you going to take away my thyroid medication because it gives me life? And that's how I feel. Like, I don't care. I'm going to take thyroid hormone along with bioidentical hormones the rest of my life and love every minute of it because they're not considered a medication. They're not like a statin that you want to get off of. They're giving you life back.
When you love it, like you love your morning coffee, and then why would you want to give that up?
Yeah.
Like,
never.
Do I have to take my morning coffee for the rest of my life? Please, I want it.
I love how you put things. I love it. Like every analogy you've dropped has been gold. But that's true.
She's super analogy girl. We call her SAG.
But sometimes they don't work. And Pearl's like, I'm not following. I'm just not tracking. Sorry, try again.
Hey, but then Joyce says, and I put these kind of together because we get a lot of these, and we touched on it last time, but this is a different way of putting it. Joyce says, my daughter's functional doctor prescribed NP thyroid for her. It's a more natural medicine than Synthroid, which is more commonly prescribed. I assume the SYN stands for synthetic Synthroid. And she said, insurance may not cover NP thyroid. It was just a statement, but I put it in there because what are your thoughts on, of course, we've got NP, we've got just T3, cytomel, or we've got Synthroid. Can they all play a part even if one's synthetic, one's from a pig? Could you elaborate?
Yes, I love this question. I'm so happy it came in. Okay, so we need to also break out of the thought process that there's synthetic and natural. The only natural thing about NP or Armour thyroid or any of the NDTs is that it is a desiccated thyroid derived from a pig's thyroid gland. But guess what? It's made by a drug company in a factory that makes drugs. So you are still taking a drug. And it's not necessarily natural. It's not like there's a farmer out there drying their pig's thyroid gland and sprinkling on your cereal, right? It's not happening. So when we look at Synthroid, Cytomel, liothyronine, Levo, all of those synthetic, we'll call it, I actually retermed it. I call them biosynth because they are biologically identical to the hormones that your body makes, T4 and T3. And it's just all about what you need. We have to find out what's going to work for you. There's no one size fits all. NP is not better than Synthroid and T3, but here's the thing with NP, you are getting a little bit of T3 in it. You're getting about 20% T3. Now, is that the right dose for you? Don't know. You have to look at your labs and compare it with how you feel. But the same thing can be said, like, let's break up the Synthroid and the T3 and find the right dose for you as well. And many people actually do better on the biosynth medications because we can change the ratio. With NP, thyroid, and Armour, we're stuck to that 80% T4, 20% T3 ratio, and we can't change it. We can only change the dose. With the others, we can change the ratio. We can give you a little bit of T4 and bump up your T3 if that's what you need.
Oh wow, I learned
What?
something new
I did
and
too.
I'm so excited.
Okay, so
That's
I
amazing.
loved having you on because I learned things and I'm such a nerd. Biosynth, I haven't heard that. So I'm going to just include that in our book and quote you, Dr. Amie. Give credit where it's due.
Yes.
But you came up with that biosynth. Thank you.
Yes, I
That's
did.
amazing.
Because women are so confused about that synthetic. I can't take that, but it's a drug. But it's natural and it's synthesized in a lab, yes, but it is bioidentical to what your own body makes.
Wow,
Yes.
so
Now that's different
good.
with hormones. Like when we're
Yeah.
talking about progesterone,
Yeah.
you don't want synthetic progestin. You want bioidentical micronized progesterone, but it's different when we're talking about the thyroid meds.
Yes,
Amazing.
it's definitely the same.
This
with
is an
the
interesting
estrogen.
question from Danae Thompson. Which Pearl? You've got two names here. What's the deal with that?
Some
Jacobs?
people have two names on their Facebook.
okay.
Serene, you
Can
know, if
T-
you were a Facebook, you'd know that. But
Can TSH be too low? Now, is she a freshie? Not on medication at all?
no,
This
she's on
person?
medication.
Okay. Can TSH be too low? And do you recommend iodine? If so, how much?
And then I added my own question to this because we see a lot of labs. Women send us their labs even though we're not doctors. And, you know, maybe they're on NP and a small amount of T3. And one lady might have a TSH of 0.4, right? And another 0.04. And they're still kind of taking similar medications. Maybe they both feel fine. And some doctors out there, like functional doctors, they say never have it below 0.4. Others are like, it can go to 0. I would like to ask the Thyroid Fixer her official opinion on this because I want to know.
Well, we were having an argument, you and I, the other day for a
Yeah.
good 2 hours about it. So can you fix it for us?
Oh, I get to decide a bet. Okay. All right. So I just gave a lecture to the BHRT Training Academy too on this, teaching their practitioners about all things thyroid, T3, TSH. And I brought up this point. Why are doctors freaking out over low TSH when post-thyroid cancer, we strive to keep that TSH suppressed?
Yeah.
So number one, no, we don't care about a low TSH because here's the other thing. When we look at basic biology, we know that TSH is a pituitary hormone and it's responding to the thyroid hormone that's in your body or the thyroid hormone that your thyroid is making or supposed to make. So when TSH goes down, it's basically just saying, you know what, I'm happy here. There's enough thyroid hormone going on. I don't have to scream and yell at the thyroid to produce more. I can just sit back, chill, take a vacation. I don't need to do my job. I'm just chilling. So TSH will go down basically with any amount of T3 that you're on. I mean, you put T3 in the mix, that TSH is becoming suppressed. But again, who cares? If you feel great, who cares? Now, it's different if you're actually feeling hyper. So if you have a low TSH, an elevated free T4, an elevated free T3, and you tell me I'm jittery, I'm sweaty, I feel like I'm crawling out of my skin, I can't sleep at night, I'm anxious, then yeah, you're probably hyper. But outside of that, a low TSH does not mean hyper, and it's nothing to worry about.
Am I right that it all came from, it all kind of stems from when someone has Graves' disease or is officially hyper, their TSH will be suppressed, and that's why people freak out because they see a suppressed TSH and they think Graves, but it's not Graves, it's the medication telling your pituitary to chill out, right? Cool down.
Right. So it's only Graves if you have those positive TSI antibodies, and you're only hyper if your free T3 and your free T4 are both elevated and accompany those symptoms that we just talked about.
Now, I just went into brain fog about that one particular scenario with a
I remember it. This functional
TSH,
doctor said to us, because we were kind of bickering about it, we said, you don't need to worry, and she's like, no, the pituitary hormone doesn't speak to just the thyroid. The pituitary gland itself speaks to other parts of the body. So what would you say to that? Because I'd love to know.
Oh no, that's true, because we have the HPT axis, the HP adrenal axis, the HP gonadal axis. So she's right. It starts with the hypothalamus, talks to the pituitary, talks to the other glands. But when we're talking about TSH specifically, that's only correlated to thyroid.
That's enough, right? To talk to have different conversations.
Two different conversations.
Yeah. Okay. Makes so much sense.
I like that. Okay. So my turn. Jane Grace. Is reverse T3 helpful and important when there is no thyroid remaining following 4 surgeries? Something about no feedback loop with no thyroid.
Yeah, because in our first podcast with you, we talked about the absolute crucial importance of reverse T3 testing, but she's saying, I have no thyroid, basically. So how would you answer that?
Well, if you have no thyroid, you better be on medication of some sort, and you better not be on T4 only, because they removed your thyroid gland that produced T4 and T3, and they removed the gland that is the main conversion gland of T4 to T3. So if you are on a boatload of T4, if you're on T4 only, and quite frankly, if you're on any T4 whatsoever, you always, always, always want to test the reverse. The only time that we don't really have to test the reverse T3 is if someone is T3 only. We know that the reverse is going to go down. Really, unless they're in a major crisis of their body, trauma, injury, some type of infection, then that will reflect back in the reverse T3. But yes, absolutely, you have to get that tested, because that's telling us how well you're converting the thyroid hormone replacement that they're giving you after your thyroidectomy.
Okay, well, I have another pearl question that's stemming from that then. Can you have too low a reverse T3? You know how reverse T3 is kind of our hibernation hormone, and it's there to keep us alive.
If you're not on T3 only, because she just said if you're on T3 only, it's going to go.
Yeah, but right. Okay, but what if you're on a little bit of T3, a little bit of NDT or T4, and let's just say your reverse goes down to a 4 or a 5. Are you okay with that, or do you like to see it 8 to 12? What are your wonderful ranges for reverse T3?
Hey, we're going to talk to you about the Thyroid Fixer. You all know that we just love to go on about the thyroid, because why? It's your master gland. It drives so much that happens in the body. And when it's off kilter, it throws you into hormonal depletion or hormonal imbalance. Now, our friend Dr. Amie Hornaman, you probably heard us interview her on the podcast, aka the Thyroid Fixer, has developed the Thyroid Fixer, a supplement. And this product is huge. It's a huge key to optimizing your thyroid health and ultimately your hormonal health.
Yeah, it's powered by T2, Serene, which is actually the forgotten thyroid hormone. We often hear about T3, that's our active, our Superman thyroid hormone, but T2 is crucial as well, and it works at the mitochondrial level to supercharge your metabolism for fat loss. It helps you burn calories even while you rest, while you're sitting, while you're sleeping, and it stimulates muscle activity, ensuring, and this is big, that you lose only body fat, not muscle. And Serene, you and I are all about this. We actually love this product. We actually investigated this product when Dr. Amie first came out with it. We were like nerds. What the heck is this T2? We did big nerdy study about it, and we've used it. And you know, I'm obsessed with the thyroid, right? But we have different thyroid hormones, and thyroid medications are usually just T4. Sometimes T3, but where's the T2?
I know, and sometimes if you think, I need extra help, so I'll go up on the T3 or T4, then you can lose the muscle. But when you optimize, put the T2 in there, you protect your muscle. It's a big game changer.
What I love about this is whether you're already on thyroid medication or you're not, you can add T2 because it doesn't affect your lab work.
It's not under prescription.
No, so you don't need a doctor. You just can purchase it from Dr. Amie's website, and we highly endorse it.
And also what I love about it is it browns your fat.
Yes.
And brown fat is a healthy kind.
It helps you burn white fat. So go to Dr. Amie's store, and here's how you spell it. It's www.Dramie Hornaman. It's spelled HORNAMAN.com. So it's DrAmieHornaman.com. Get it right.
Honestly, I don't really care, but it does come down to the individual. So if they're on, let's say they're on hypothetically 50 micrograms of T4 and they're taking maybe an equal amount, 25 and 25 of T3. And we look at that reverse T3 and we see, oh my gosh, it's all the way down to a 4. Okay, this person is converting their T4 just fine. Let's ask them how they feel. Maybe they're not feeling quite too spectacular. We look over here at the free T3. That's optimal. We know they convert. Okay, that tells us we can increase their T4. Whereas if we take that same scenario and that reverse T3 comes back at 11, I'm not touching their T4 because we know they're right on that borderline that more T4 medication is going to push them into a high reverse T3. So it's not that I care about it, but it gives me feedback in terms of what we can do with their dose and their medication.
Do you see a lot of women, I've heard you say optimally kind of 12 or below is kind of great for reverse T3. Other functional doctors say maybe you could get up to 15, but as we say, we see a lot of women's blood work and
because they're insulin resistant
and they're in the 20s. Now you optimize their thyroid, they come down some, but they still might just get to that 15, 14. And do you see that, where they just can't quite get to the 12 yet, and we think, well, hey, you got some resistance training to do there. We've got to optimize your diet. Is that where you go?
So I will accept 15 or less. Okay. So I will accept between that 12 and 15 mark if their free T3 is optimal and if they are symptom free. And then we say, okay, I don't care that you're coming back with a reverse of a 15. But if they're still symptomatic at that number, then absolutely let's dig into what's pushing up that reverse T3. And that will actually tie back into one of your previous questions that I didn't answer. I apologize. Iodine. Low iodine is a huge contributor to elevated reverse T3. So we want to look at insulin. We want to look at estrogen. We want to look at your diet. We want to look at your lifestyle, your stress, all the things. But then also let's add in some iodine because that will bring down the reverse T3 as well.
Do you want to talk about the whole iodine protocol that you did?
How do you feel about, are you more of a low dose iodine kind of person, or I had fibrocystic breasts in my 40s, and I once did a very high protocol getting up to 50 milligrams of iodine, and I got very hyper.
But apparently the soils in New Zealand have like the least, that's where we're from, the least iodine, internationally. And apparently her thyroid just acted like a sponge more than normal people.
And so I went super high. My resting heart rate was like 130.
She got Graves. She gave herself Graves.
So, and what do you think about that? I mean, it's not for everyone high doses, or where do you go with iodine?
I'm a low to moderate girl. So I'll start people off at a low dose. And I guide my patients in titrating up very slowly. And we might get to 50 milligrams. I don't know. Maybe we'll just hit 25, like 12.5 to 25 is a really nice sweet spot. But we might go up in cases of fibrocystic breast. It is amazing for that. Uterine fibroids, nodules on the thyroid, elevated reverse T3, hair loss. Oh my gosh, it's amazing. So and I always tell people, you will know, just like you did, you will know when you take too much because you're going to feel hyper. You're going to feel like you drank too much coffee. You're jittery. All you have to do is stop it for a day, add some salt, take some extra salt, LMNT, Redmond's real salt, whatever, throw it in water, drink it down. That will start balancing out the iodine. And then when you start back, just start back at that last dose where you felt good. So maybe your last dose was 25 and you're like, that's perfect. That's what I'm
and I know, and I did it because of all the testimonies. It turns people's lives around and their health around iodine. But
is there a testing people should do first, or does everybody, would they respond to a very low dose, just like a a regular supplement to take every day.
Yeah, like are we all a bit iodine deficient? I think
people
we
get
kinda
into
are.
magnesium. Everyone should be taking magnesium, blah, 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 blah. Is that the same with iodine?
Honestly, I put iodine in what I call the no duh supplements. Like, no duh, of course you take
Yeah.
these, right?
Yeah.
So yes, I would say that everyone needs iodine because we're all iodine deficient. I actually interviewed this researcher that does a lot of HTMA testing, and I said, "Do you have iodine on your HTMA panel?" And he said, "You know what? No, because every cell in our body needs iodine."
Okay.
So why not you just take it? We don't need to know your levels because you're going to need it. And as soon as you
Okay.
start taking it, your levels are going to be high. They're going to show high on your lab. So you're not going to reduce the iodine. You're going to keep going with it.
That's interesting.
Very
Hey,
interesting.
Jessica gave you this.
Oh, this is a great question.
Yeah, we've listened to your podcast on this over and over again, but she said, what is T2 and is it important? I think you're the official expert on T2 out
Yes.
there.
Yes, I've been studying it for around 15 years now. And T2 is so amazing when you get down into the science of it. So it is a thyroid hormone produced by your thyroid gland. It is present in NDT medications because it's in a pig's thyroid too. So when we dry that out and put it into NT or Armour, it is in there, but it's in a really minuscule amount. So researchers did some studies on rats, then humans, and they used a little bit of a higher dose. They used between 150 micrograms and 300 micrograms of T2. Comparatively, there's around like 6 micrograms in a 60 milligram tablet of Armour.
Wow.
So that kind of gives you the
Yeah.
numbers. And what they found when using 150 to 300 was an average weight loss in a month of 9 pounds, 4% decrease in body fat in 28 days, reduction of lipids, improvement in insulin resistance, and really an increase in your basal metabolic rate and ATP production. So what people were feeling and what I have experienced using it with my patients and now, customers of buying Thyroid Fixer, what I've heard back is that it produces a very nice steady energy. And yes, they absolutely notice that their metabolism increases, that they are losing weight on a nice steady basis where they weren't before.
And is it right that it helps with the losing weight and not so much losing the muscle? Because so many times if if your thyroid hormone, you get a little bit too high, is it like a concern for losing muscle mass? Can you speak to that?
Yes. So T2 only burns body fat, whereas T3, which is prescription. So it's good to differentiate. T2 is available in supplement form over the counter.
Yeah, you
T3
have a supplement, right? It's called the Thyroid Fixer itself.
Should
Right?
everybody be on that alongside their prescription if they have a thyroid prescription? Should everybody? Is it just something they should do?
Honestly, yeah, I think so. So if you need to lose weight and improve your energy, so I put T2 in Thyroid Fixer and in Metabolism Fixer. So it's in both of those products. And I named the first product Thyroid Fixer because it's after me. It's after the brand, right? But in hindsight, I should have called it something else because everybody can take it. You don't have to have a thyroid
Okay.
problem
Oh.
to take T2.
Ah.
But if you are one of those on T4 only, my God, please add it in because it's
Yeah.
only going to help you because we know T4 only isn't going to help.
What about people that
So-
are thin? They don't want to lose weight, but they really just want to just take a wonderful supplement like T2.
Well, if
For
they're
all the
low
other
in
benefits.
energy.
Okay, so
if
it's
they're low
energy.
in energy, mitochondrial function, all of that, or if they're insulin resistant, because you can still be insulin resistant and be thinner. But I would just say, make sure that you are eating because if we don't want you losing weight, just increase your calories to offset the increase in metabolism you're going to get.
And how much are the milligram? What kind of dose should people be taking? I mean, obviously it's already in your Thyroid Fixer and you'd have a serving size there, but is there just a number they can know in their head?
Yeah, I would go between 150 and 300 because I get that question all the time. Can I take Thyroid Fixer and Metabolism Fixer together? And I say yes, because each serving of each one of those is 150 micrograms.
Okay.
And they did go up to 300 micrograms safely. No cardiovascular side effects, no jitters, no feeling amped up, no thyroid effects, meaning it's not going to change your labs to where you're going to look hyper or feel hyper. So anywhere between 150 and 300.
It doesn't really affect anything like TSH, T3 or anything like that. Do you ever see, if it brings down insulin resistance, do you see that in labs? Do you see insulin coming down or perhaps even a reverse T3 coming down, which is sometimes an indicator that insulin resistance is getting better?
I've never seen the reverse T3 come down specifically just because I haven't used just Thyroid Fixer with a
Right.
patient and monitored their reverse.
Uh-huh.
Normally I'm doing all the things,
Yeah.
we're treating, we're changing up your diet if you're
Yeah.
insulin
Yeah,
resistant.
yeah,
We're
yeah.
adding in some berberine. We're
Yeah.
doing all the things, and we're fixing your thyroid over here by using the right medication to bring down the reverse, like tweaking your T4 and your T3. So I don't know, because that would have to be kind of an individual, not one of my patients, anecdotal evidence where maybe a consumer would
Right.
write back and be like,
Yeah.
I just did Thyroid Fixer.
Right.
My reverse went from, which would be
And
kind
there's
of cool.
another interesting thing about T2, and I believe I heard it on your podcast. Browns the fat. Is that
Browns.
browns the fat?
I'm so fascinated with brown fatting agents, browning fat agents.
Well, 'cause we're all
Yes.
jumping in the cold plunges
Yeah.
to stimulate.
But I
that
want to do
brown
it
atom.
without doing it in the cold plunge.
Yeah, we don't want the cold. No, thanks.
exactly.
My husband and all my sons are always cold plunging, and at Christmas they're like, "Well, just come on Christmas morning." I'm like, "That's the very day I'm not going."
Right, it's cold already. Yeah, exactly. No,
Yeah.
it does. It works on stimulating brown adipose tissue, which is the fat that we want. We want that brown fat. We don't want the white fat that clogs our organs, and that's the fat that we're grabbing and saying, "This is what I need to lose." So yes, it browns your fat, which is a good thing.
Yeah, I know people can think, how can fat be a good thing? Well, brown, I mean, fat, some fat, we need fat. But brown
We need-
fat
right.
is thermogenic fat, right? It's an incredible fat for our metabolism. Hey, here's one, though. We got so many questions, Dr. Amie, on nodules. I took a few of them. I didn't even know. It was hard to leave questions aside. But so let me. I've actually had nodules before too, so I just felt for all these women. And this Moira, she says, I have a 5 centimeter nodule on one side of my thyroid. Had a biopsy done, came back benign, but he wanted to cut it out. I choose not to because my thyroid blood work comes back normal. Every year I get a full thyroid panel done. It still comes back normal, but I have problems. I am cold all the time in my hands and feet. The normal means nothing, Moira. But still have a good sized noticeable nodule, which is made worse, I think, when I eat raw broccoli. Dr. Amie, can you talk to Moira?
Yes. So just like you said, normal does not mean optimal. So I would love to see you, Maura, get the full thyroid panel done and really compare it to the optimal lab value ranges. We have a download on my website under freebies that it's a, get these labs, and it'll tell you all the labs to get, and then it will give you the optimal lab value ranges that we want you in. So you can really compare and see, am I just quote unquote normal or am I actually optimal? And when you're optimal, that's where all of those symptoms should go away, or at least most of them. Nodules, iodine. The biggest cause of nodules and goiter is low iodine. When you start adding it, same with fibrocystic breast, when you start adding in that iodine, those nodules that our body builds up in our thyroid gland or breast tissue or uterus, I mean, those really dissipate. They really respond well to iodine treatment.
Do you find, though, that nodules are often associated with Hashimoto's? Or is you can have nodules without Hashimoto's? And my third question would be, can you really have nodules and really have a well-working thyroid?
No. I
Yeah.
say that all the time. Oh my God,
Yeah.
I love you. I love you for asking that. So many people say, I have these nodules, but just same as Moira said, but I'm normal, but my doctor says everything is fine. What other gland or organ can have a growth or a tumor on it and we go, oh, that's all right, we're just going to ignore that, you're okay? No, we always dig deeper because it's abnormal for our body to grow a growth on it without there being something wrong with it. So it's not always associated with Hashimoto's. It can just be non-Hashimoto's thyroiditis, and you can have nodules, but that always is reflective back to something is wrong with that gland, with the thyroid gland.
Interesting.
Did you leave the Mary David question out on purpose, or would you like me to go back to that one? Because she seems
I
very
wanted
desperate.
to get to the
She's
nodules because, yes, but I still had something to say about nodules.
Okay, good for you.
Yeah. I have read this, tell me if I'm wrong or right, that thyroid medication itself, if you get optimized, can help with nodules themselves. And part two, it can help with Hashimoto's itself, to a certain extent, bring those numbers down. Am I right or wrong about those two things?
Yes, absolutely. Okay. So when you think about, I love using analogies too, by the way. So I'm going to throw one at you. When you think about autoimmune, think about a woman at the end of a hard day. And, she's taking care of everybody else but herself. She finally sits down, watch some Netflix, have a nice healthy snack. And everybody starts coming in. Ma, can you do this? Honey, can you do that? The phone's ringing. And you're like, oh my God, not one more thing, right? But if she's supported, if people are helping her all day long, if she feels good, then maybe come 7 o'clock when she's ready to sit down and watch Netflix, she can do one more task. It's cool. I can do this. I can get that done. Then I'm going to sit down and chill. What does all that mean? That is your body in an autoimmune state. Your body in an autoimmune state, unsupported, is like the woman at the end of the day, like, I'm not getting up and doing one more thing. You can forget it. Just leave me alone. Whereas when you have the right thyroid medication on board, the thyroid is working well, the body feels good, your energy is good, your mitochondrial functioning well. Yeah, you can take on one more thing. It's okay. That autoimmune, that kind of just goes by the wayside. Antibodies start going down. But when you're not supported, it's not happening.
I so understand the points when the analogies are just so clear to me now. It's going to be there for the rest of my life in my head.
Yeah, that's
it's so
good.
clear. That was so
and back
good.
to the nodules thing. Have you ever seen nodules recede with just plain old good, well-optimized thyroid therapy?
Sometimes. Yeah,
Okay.
absolutely.
Yeah.
Sometimes. I mean, we're always doing the nutrients with it, though.
Yeah.
You're always saying, well, make sure you're doing a little bit of iodine and magnesium and selenium and keep your D up and all that. So we're doing all the supportive nutrients with the thyroid treatment. And that's when we really see nodules respond. And black cumin seed oil. I mean, that's the bomb for reducing inflammation and nodules and antibodies all at the same time.
I will never be without that. I take black cumin seed every single day.
Well, hey, I
Thanks to
loved
you and your
when
podcast.
when you talked about nutrients, blah, 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 blah. I have a question for you. So I've always loved putting ashwagandha in my, what I call my yuck yum, my smoothie that's so it should be so yuck because of all the crazy things I put in, but it's still yummy somehow. I don't know. But anyway, ashwagandha was one of my ingredients. But then I read the other day, anyone on thyroid medications shouldn't be taking ashwagandha because it can mess with it. Is that just a crazy little thing I read, or is that...
Yeah,
True.
ashwagandha, that just lands in one of those like middle tier, just don't know, need to personalize the treatment, don't just throw it in kind of supplement. So if you're taking it and you feel good, and because I've had some patients that are on it and they're like, if I go without it, I don't feel right, I don't sleep, I don't ... whatever. Then if it ain't broke, don't fix it. If you're taking it, you feel better, keep taking it. But I wouldn't recommend it to start. I wouldn't say, hey, you need ashwagandha. I would say, let's test your cortisol first, because ashwagandha is that balancer of cortisol. And we really want to know what your cortisol is doing before we start throwing things at it.
Yeah. That's wise. That's wisdom. I just always I'm one of those people that just keeps throwing the spices in the pot. So I throw all the supplements in the blender jar, about 50. Yeah.
That does sound a little yuck.
I thought so too, but now I'm addicted to it. What you want to speak to Mary's? And Mary's was
well,
the
there was
first
3
of
exclamation marks.
A lot of questions we had about people with thyroid removed already. They're so desperate and they're being ill-treated.
So due
Amie?
to thyroid cancer, Mary says, my total thyroid was removed and the bed scraped. Then had 131, whatever that is, to destroy any residual cells. So I am permanently on thyroid, and I live out in the country in Texas, and we have limestone in the well, so it binds the thyroid. While the generic is supposed to be no different than the brand, when I try to convert, my levels go crazy, so I can only use the brand Synthroid at this point, 2 decades so far. I do struggle with weight, and everything I see for resources are to pep up your thyroid or improve your thyroid function, when in my case, I cannot encourage thyroid regeneration. So what can I do that would be appropriate for my circumstances? And she's got 3 exclamation marks. Thank you, she says.
Right. So for all thyroidectomy patients out there, radioactive iodine, partial thyroidectomy, you need T4 and T3. I mean, you're talking about conversion. You're giving the body all of this T4, and it didn't sound like she's on any T3. So you're giving the body all of this T4, and you're no longer producing any T3. So literally your doctor is giving you this boatload of T4, the inactive thyroid hormone, and crossing his fingers and wishing on a rainbow that it converts. And you're saying, well, listen, I think I have a conversion problem. I have all these symptoms. Well, yeah, because you need T3. They took out the gland that made T3. They took out the major gland that converts T4 to T3, and they gave you T4 only. Even when you say it out loud, It doesn't make sense. So it drives me crazy
Yeah.
when thyroidectomy patients are treated this way. It's just wrong. I mean, it's actually borderline malpractice, because if the docs would just step back and think about basic biology, you wouldn't do this to a person. So Mary, you need some T3 in your life. Get a water filtration system for your drinking water, or get a Berkey and sit it on the counter to get the limestone out when you're actually taking in water. Yes, there is some binding, issues with the limestone in the water, but that's not the be all end all. The be all end all is the med that you're on.
Yeah,
I mean, you're
that's
so
good.
right, and we had so many questions that were your thyroidectomy patients. They were just pretty much all the same thing. And they're like, I don't feel well. I'm still gaining weight. I had my thyroid out. I'm on T4. I mean, it's a travesty. Why are doctors not being trained in what is just logical?
That's all they're taught in med school. It's basically, if TSH is above now it's a 4.5 cutoff, then give T4, period, standard of care. Thank you. And, we could get into the whole, like, who actually is giving money to the med schools? Is it Abbott that makes the Synthroid? Who knows? Who knows the behind the scenes and all of that? But it is interesting. You rarely see clinical trials or studies done on T3. They're always T4 monotherapy is great. Well, who's funding the study? Who's funding the med schools?
Can I ask you something? Because I see a lot of women, that had maybe thyroid cancer or whatever, they had it taken out and them struggling. But people come to you to get optimized. It's hard. Would you say it's harder for them to get optimized so that they can have a good metabolism, lose weight? Or do you see people come without a thyroid and you get them on the right amount of T4 and T3 and they actually start to shed the weight, and do they do it? Is it possible, Dr. Amie?
Absolutely.
Yeah.
And actually, sometimes it's easier because now we don't have their own thyroid hormones in the mix. We can just start them at 0 and build them up from there. So honestly, it doesn't matter either way, but 100% yes. With thyroidectomy patients, yes. We can absolutely get you optimized.
I think that's giving so much hope.
Oh, yeah.
Because like these women said, she's like 2 decades, the other one's 3 decades. They are just, I mean, like you said in that first podcast, I heard you say, it's like when your thyroid's not optimized, like walking around in life and you're pulling this big, huge tractor tire behind you on a chain. I think you said something like that, but I always remember that picture. You're walking around dragging something and I just feel
and your doctor's telling you you're just perfect.
Yeah, no, you're normal. I feel for these women.
Well, and you know what? We're all given a certain amount of time on this earth. We're not getting more time. We're not getting younger. So why not do something now so you can live your best life and enjoy every single day feeling your best?
Yeah.
You don't want to be dragging through life, wasting 2 or 3 decades, dragging around a tire or not feeling your best. That's no way to live, and it's not fair.
I know. Well, this comes with Stacey. Serene, I'm jumping because there were a bunch of questions I dumped together about the same subject, but for the sake of your time, Stacey said this is a good one because she says, well, how do you convince your doctor to optimize thyroid when your labs are normal, but they're not? That's a big question, right?
That's the $1 million question right there.
That's why you do what you do.
Convince, or do you find the
right?
Find a good doctor.
Might have to come work with me. Honestly, it's tough. It's tough. You can have the conversation. You can bring in studies. You can send them, my podcast, all of that. But that doesn't mean they're going to listen. Because again, I mean, this is how they were taught. I gave a talk years ago to this integrative wellness group, and this has stuck with me forever. We talked about why are you not testing reverse T3? Why are you in the Synthroid box, the T4 only box? And the one doc raises, and this is integrative, not even conventional, integrative wellness doctors. And the one doc raises his hand and goes, that's all we've learned. And literally that's all they've learned. So unless they go outside and find additional training, they're going to continue with their standard of care. Like that's what they were taught.
And, and doctors, I mean, we're not downing them. They're good people. They have a heart to help.
Right.
So, I mean, you know them. I mean, but it's sad because they're so busy. There's like 5 to 10 minutes with a patient.
Yes.
They don't have time to go study. I remember
It's so true.
when my husband was 50 and he was showing low T symptoms, and I said, honey, I think you've got low T, it's like, he didn't really want to hear it at the time, but he went along with it. So I said, I'm coming,
Especially from you.
Yeah, especially from me. Your wife says you have low T, let's go get it fixed.
Right.
But we went to his GP and, I came along with all my studies in my hands. He didn't want to see me. He didn't want to hear me. But I was saying, but look here, because his T's came back at like 324 or something, just above, the bottom of the range. And I'm like, but even with levels like that, he's not going to feel so good. I feel like there's something wrong with my husband. I know my husband, he's not the same guy as he used to be. And he just looked at me like I was nuts and that I shouldn't go online, So then I said, honey, would you go to another doctor? I made an appointment with a hormone specialist, and, he sat down. I sat down with him, and he's like, your T level, man, you must be feeling badly. Those T levels are so low. Let's make you feel better. And it was just this look on my husband's face like, he gets me. I don't have to force him. My wife doesn't have to cajole him. That doctor was the one saying, yes, you need this. And it was a whole different thing. I think forcing doctors is very hard.
Yeah. It's very hard. It's very hard because they're kind of set in their ways. And like you said, they don't have a lot of time. They're driven by the insurance companies, 5 to 7 minute visit. That's about it. So really you have to find that person, that doctor, whether it's conventional, integrative, or functional medicine, that is going to spend time with you and that is willing to think outside of the box and maybe has done some additional training outside of med school.
Right.
Yeah. Well, hopefully the word is getting out. I think the word is getting out. Even with this last podcast we did with you, women are starting to speak out to their doctors.
Now, Pearl, did you want me to ask this question about the Hashimoto's, or do you think we've kind of
I think we've covered it. Well, what about hair? Hair loss is a good one, though. So many women experience hair loss. And obviously it's not all. We're talking about the thyroid today, but the thyroid is one part of a big picture, right? But it's a big part of all the other hormones. But can you talk about hair loss? JC says, what causes hair loss? Can it be restored? She has Hashimoto's thyroiditis, and she wants to know if it can be reversed without synthetic medication. That's the synthetic medication. Again, we've covered that, but let's do the hair loss part.
The hair loss. So hair loss is, just like you said, very multifaceted. So yes, absolutely. When we want to check your thyroid, we want to optimize that. We want to look at your hormones. We want to look at your insulin. We want to look at your ferritin levels, how much protein you're taking in.
Yes.
So, I mean, there's so many different aspects to hair loss and what's causing it. It could be androgenic alopecia. It could be alopecia, another autoimmune condition. So where we see Hashimoto's, we normally see other autoimmune conditions. It could be leaky gut. It could be a lack of nutrients. There's so many things. But yes, of course, you want to start with the thyroid, but you want to check that box and check everything else as well.
Yeah.
Hair loss can be restored as long as there's still a follicle there. And as long as the follicle itself has not been completely destroyed, which it might be in the case of autoimmune, where your body actually attacks the follicle, then yes, you can experience regrowth if you're doing all the things. Hair is usually the last to come back. I'll have people gain energy, lose weight, feel better, libido's back, all of that. And they'll be like 6 months later, they'll be like, I'm still waiting on the hair, because the hair takes a while to actually stimulate and grow.
It's interesting that you said libido.
Yeah, I was about to jump on that too.
Because maybe is it just because energy is back and that translates to libido, or is it actually libido? Like, you think estradiol, testosterone, you think those things when you think of, helping libido return. But thyroid hormone, I had never really thought of that as a low libido, but speak to that. That's so intriguing.
So again, with libido, kind of multifaceted, right? There's a bunch of different things that play into libido, but with thyroid being at the top, it's going to have an impact on our sex hormone. So it might be the cause of a little bit of low testosterone. The other thing with thyroid is how we feel about ourselves, right?
Yeah.
So if we're tired, if we're holding extra weight, we're frustrated, we're in this place where we're like, I'm doing all the things and the weight won't come off. Do you want to get naked? I don't even want to look at myself in the mirror when I'm in, let alone somebody else look at me naked.
Yeah.
So it's kind of that too, that when you feel, as a woman, when we feel better about ourselves, I mean, I'm not talking perfection. I just mean we feel like us. We feel like ourselves again.
Yeah.
Then we're more willing to even participate and enjoy.
Yeah, that's so good.
What about, do you have Marita's question there, Serene?
Marita. Oh, yes. Marita says she listens to you regularly. The link between ferritin and thyroid, and how to get both optimized if you're having trouble doing so with oral iron. I listened to a podcast regarding this, but a refresher and info would be helpful again. I've used Hemi supplement and beef liver and Vitronic. This helped out, but as soon as I stopped, my ferritin dropped again. How long does that typically take to get optimized? And the link between thyroid, ferritin, and sex hormones? My T was really low, if there is one, and could it be leaky gut causing the absorption issues? There's a
You're
lot
not allowed to
in there.
forget one question.
That's all right. I got it all.
You're amazing.
So, the link between ferritin and thyroid, they mimic symptoms. So whenever we see low ferritin, it'll mimic hypothyroid symptoms. So even when we get someone's thyroid online and optimized, if they have low ferritin, they can still be gaining weight, have low energy.
Wow.
Ferritin also is connected with hair loss. So when we see low ferritin, we see a lot more hair loss. So that's another box that needs to be checked in the hair loss category. But when someone isn't responding, well, first of all, it sounds like every time you go off supplements, like the supplements are working to get your number up, but then when you stop, your number drops back down. That just tells me that you probably have to stay on those then the rest of your life.
Yeah.
Make sure that you're taking your iron supplement 4 hours away from your thyroid medication so there's no interference and binding there. But
Oh,
you might just have
is
to
that
stay
the
on it.
case with desiccated liver?
Not I don't know. That's a good question. I don't know. I'm not sure about desiccated liver, but I know anything with ferrous bisglycinate or iron or heme,
Yeah.
that needs to be taken 4 hours from thyroid medication.
Okay, good.
Yeah.
Very good.
So it could be leaky gut in her case, but it could just be that she just has that propensity for low ferritin, and she just needs to be on, at least the beef liver for ongoing.
I mean, I haven't really looked into this whole low ferritin business personally. Are there any particular things that can cause low ferritin? Like you think things that cause insulin resistance? We have a good idea of that. But I mean, are there any?
Oh, I think I suffered with it, and that was
Low ferritin.
heavy periods, lack of progesterone.
Yes.
Once I've
Yep.
so many women brutal periods cause it, right?
Okay, yeah.
That's the big one, right?
Yeah.
Is the heavy periods, because we know that when someone has elevated ferritin, that's a marker of inflammation. So we say, okay, go donate blood.
Yeah.
That will bring down the ferritin. So think about a heavy cycle. My
Yeah.
gosh, that's like 3 to 5 days of heavy blood loss. So that's absolutely going to drop your ferritin levels.
Good, very good.
And then we've got one from Aqualine. She talks
That's
about
a cool name. My goodness.
Yeah,
I know, that's really
LDN, LDN for Hashimoto's. Can you sometimes your thyroid medicine requirement go lower when you're on LDN? For those unfamiliar with it, you might want to talk about LDN. And my question follow up would be: have you seen black common seed oil work as well as that, or which do you prefer? And I would love to hear your thoughts on these.
Absolutely. Okay. LDN is low dose naltrexone. So we're using naltrexone, that is an anti-opioid, anti-narcotic. We use it in even alcohol addiction to block those receptors. That's used in like 50 to 100 milligrams. Low dose is used from 1.5 milligrams to 4.5 milligrams. And what we see with LDN is a decrease in inflammation, a decrease in Hashimoto antibodies. Oftentimes people will see an improvement in their insulin resistance. So that inadvertently helps with weight loss. And yes, to answer the question, yes, we can see a need for less of thyroid medication. So maybe bringing the dose down a little bit, because essentially you're bringing down those antibodies that are soldiers. Those antibodies are soldiers that are going out and they're attacking your thyroid gland because they think it's a bad guy. So when we reduce those amount of soldiers and they stop attacking your own thyroid, your thyroid can be like, oh, okay, now I can produce some thyroid hormone. I can get back to do my job because I'm not getting beat up every single day. So yeah, it's going to kick in, and hopefully if you catch it early enough and you still have some thyroid tissue left, it's going to produce some T4 and T3. So that's part one. Yes, we might see a reduction. Now, when comparing black cumin seed and LDN, we see a little bit of a difference. I think black cumin is a little bit better because number one, there's no side effects to it. I mean, you could take, triple your dose in a day because maybe you feel inflamed, you're in pain, whatever it is, you could take a higher dose and no side effects whatsoever. With LDN, we're seeing a couple of side effects, and I've seen it with my patients. One of them is that it can increase cortisol. So a lot of times people will get elevated blood glucose levels. They'll push into insulin resistance because it's increasing your cortisol. We'll also see this mood shift. Now, it can go either way. You can either have this flat affect, almost like an antidepressant, but worse. Like, I don't care about anything. I've lost all feeling, just flat affect. Or you can become more emotional. I've had some patients that are like, I can't take it. I can't. I get agitated. I'm emotional. I'm crying all the time. I can't do it. Those are kind of the downsides with LDN.
Wow.
The other thing with black cumin versus LDN is, and I said this in the latest podcast that I did on black cumin, nowhere can we ever say something helps with cancer unless it is backed by a boatload of studies.
Yeah.
And black cumin seed has been documented to reduce your risk of cancer.
Yeah.
Boom.
Love that.
You know, why not
Yeah.
take it? It's like you said, you know, you take it every day. Absolutely.
Yeah.
I do.
I love that.
But you as a practitioner, when you see someone come in and they have elevated antibodies, you of course get them on, a good dose of thyroid medication for them. When do you bring in LDN or black cumin? Do you wait a while and then bring it in later, or which would you start with?
I'll start with black cumin right off the bat, no matter what the antibody level is. And if the antibodies don't come down, or if I have a patient that has antibodies literally off the charts, the ones that you're like greater than 3,000 and they can't even be detected, then I'll double up. I'll use LDN and black cumin seed together.
Smart.
Fantastic. What do you think? We've got maybe one time for one more. All right, this is from Esther. She says, does any form of detoxification with supplements or perhaps the use of a sauna a few times per week help to improve our thyroid function? If so, what would you recommend?
It can, but I haven't seen it be the be all end all. It's kind of one of those things like, yes, absolutely use the sauna for detox, for improving your immune system, for improving your metabolism, for all the things that sauna does. Yes, do a detox because we're bombarded in our environment with heavy metals and chemicals, but I've never seen those take the place of proper thyroid treatment. It just kind of is an adjunct.
Yeah, that's so true. I think so many of us, as we talked about in, part one with you, so many of us crunchies are just resistant to the idea of being on a medication, especially for the rest of our lives. So we'll do all these other things and it really won't touch it because like you said, there's a thyroid pause for us women too. When it comes to menopause, when it comes to late perimenopause, and our thyroid function declines. So why not just go for what works is I know what you say and what we say.
Put the glasses on and wear them every day.
Yeah.
Put the contacts in.
Yeah.
You know what I mean? It's just, it's no more invasive.
Yeah.
Exactly. And just really try to think of thyroid hormone replacement as exactly that. Thyroid hormone replacement, not medication. You are replacing hormones that your body is no longer properly making.
Yeah. That's so good. We want to thank you for your time. Hopefully, I know our listeners, our viewers will want a part 3 some point. So this was just incredible. You are watering us, sort of like stopping the drought out there. And we are just so grateful. Thank you so much, Dr. Amie.
I love it. I love you, ladies. Thank you so much for having me on.